We're looking at the interior of the knee joint. We see the thigh bone on the top, the shin bone on the bottom, and the inner or the medial meniscus cartilage back here. And you can see that inner cartilage looks fine. However, on the end of the thigh bone, there's certainly some roughness here. You see some jagged flaps in this area. I'm going to use the motorized shaver to slide in and see what we can do about this. Foot pedal, please, to me. Thank you. Just smooth this down here. Flex the knee a little bit, please. Hold it there. Add a little bit more. And flex it some more. So this is basically an arthritic ridge that's running along the medial border of the femoral condyle. It extends from back here. Extend the knee all the way up to here. It's not very wide. It's only about 2 to 3 millimeters wide. As we extend the knee all the way, we see that looks good there, and then flexing the knee back. Okay, now I'm going to slip on back behind the knee and look posteriorly and medially. Okay, we're back behind the knee and we see some loose debris floating around there. I'm going to use my cannula technique to remove that. Okay, so those chunks of articular cartilage are gone. Rotating the scope centrally and withdrawing, we see the posterior and then the anterior cruciate ligaments. Now we're going to slide on over into the lateral compartment of the knee joint. And this looks much better than the medial side. Get my probe in here, switch this around, get all the cords out of the way. Okay, now I got my probe in. We see the thigh bone on the top, the shin bone on the bottom, the lateral meniscus over here. And indeed, the lateral meniscus looks good. We see the popliteal tendon back behind the knee, its continuation below inferiorly. The articular cartilage on the femur looks fine there. So now we're going to map the thigh bone, straighten the leg out all the way, flexing it back. That looks good. We're just going to slip on back behind the knee and look posteriorly and laterally. And there's no loose bodies back here. Rotating the scope centrally and withdrawing. Once again, we see the main stabilizing knee ligaments, the anterior and posterior cruciate ligament, and they look good. The next step is to look at the kneecap from above. So now we're looking at the kneecap from above. That's this white structure here, sliding down the lateral gutter. That looks clear. We see some lateral meniscus material here, the popliteal tendon. All this looks good. We've taken out a little bit of synovitis in the lateral gutter before starting the video. Looking at the undersurface of the kneecap, the lateral side looks great. A little bit of roughness here in the central patella facet. We'll use the shaver to smooth this down. But what really is amazing is this large lump of articular cartilage damage over here in the medial femoral condyle. There's also some damage. Flex it slightly, hold it right there, in the trochlear groove. We're going to smooth this down. So I think there's a significant amount of articular cartilage in the patellofemoral joint, as well as that one little band on the medial femoral condyle. And this, I think, is very likely to be a significant cause of damage. A little bit of synovitis over here. So in order to access that area, I'm going to switch my water inflow in through the inferior portal and stick the shaver in through the superior portal and take this out. Now deep knee bends and squats and knee extension exercises are going to have to be avoided because of this, because that's just been chewing this area up. So I think lunges and short arc quads are probably to be avoided. So we've got that smooth down there. And now we're looking around up into the pouch where we've cleared out some synovitis. That looks good. We're back to the kneecap once again. And this concludes the arthroscopic surgical procedure.